Hi, my name is Dominic Shattuck. So I'm a men's health researcher at Johns Hopkins University, and as you may know, it's Men's Health Month. I wanted to share a recent slide deck that I used to describe men's health programming, specifically around sexual and reproductive health, how it's structured, and where these programs could be going next. I'll touch upon some historical precedents, structures used to design the programs, exemplary programs that you should make note of. I'll have a quick review of some key studies, then a couple of summary slides. In total, this should take about 18 minutes, maybe 19, and it's around 17 slides. So I hope that you're engaged. Let's find out and dive in. So in 1994, the International Conference on Population and Development in Cairo marked a major shift from population control to a rights-based approach on reproductive health and gender equality. This conference recognized reproductive health as a human right and placed women's empowerment at the center of development. Men were included, but mostly as supporters of women's health, and they were encouraged to share responsibility in family planning and STI prevention and parenting. The conference also called for challenging harmful gender norms, but it largely overlooked men's own sexual and reproductive health needs. This moment, fortunately, the moment planted a seed for future efforts to engage men, not just as allies, but as individuals with their own health needs and playing a key role in advancing gender equality. When we talk about engaging men and boys in sexual and reproductive health, we're referring to a deliberate, values-driven process that invites their full and meaningful participation. This includes viewing men as individuals, partners, fathers, and community members. This means supporting men not just as allies to women's health, but also as clients with their own needs, and also as agents of change who can challenge inequitable gender norms and promote shared responsibility among other men. This three-part framework, supportive partner, client, and change agent, helps guide programs toward more holistic and transformative impact. When we talk about male engagement versus men's health, it's important to distinguish their focus. Male engagement typically involves bringing men into health services that are traditionally directed toward women, children, and the elderly. These programs often center on topics like maternal and child health, family planning, or PMTCT. In contrast, men's health programming focuses on men as direct beneficiaries of service delivery. It includes services tailored to their own needs like vasectomy, condom use, HIV prevention, or addressing gender-based violence and managing non-communicable diseases like heart disease or diabetes. Engagement strategies range from school-based education to provider-led counseling and targeted campaigns. As you can see, the delivery of these programs are relatively consistent with women's health programming and often tailored in language and activity and imagery for the widest number of men to participate. Together, these male engagement and men's health approaches form a more complete picture of what inclusive and equitable health programming can look like. So this is just a list of some standout examples of programs addressing male engagement or men's health, and I wanted to highlight a few. Stepping Stones is one of the earliest evidence-based initiatives focused on HIV prevention. Over time, its adaptable format has been used to tackle issues like gender-based violence and mental health. The Male Engagement Task Force, which was supported by USAID, brought together a global network of approximately 600 practitioners and researchers working at the intersection of male engagement and men's health. A couple others that focus on men as recipients of health services include the Real Fathers Project in Uganda. This is a project that developed men's parenting and relationship skills through a peer-based support network. And in Rwanda, we scaled up the vasectomy services and expanded clinical capacity while creating meaningful entry points for men into the health system. Finally, a more recent project actually too is the AFCON vaccination campaign, which was designed around the Africa Cup of Nations football tournament. And this campaign was estimated to have reached more than 150 million across 4 African nations. It demonstrates how engaging men through sports platforms can be leveraged with health messaging. Goodness, I'm going to enable some content. So bear with me for 1 second, and we should be able.
This is the moment where Johnny don't reason for hair tire. Everything what Johnny don't do. Now to make sure that the thing won't happen now. Will happen. And they see him for Johnny eye. In the shop they ready. And COVID-19 bring Johnny and his wife come here. Because she get belly, it's very important for her to get the vaccine to avoid serious sickness. Somebody are too much strong. Shut that is bubble. Don't worry. Shut this mind. It's on the call. It's on the call. It's on the call. Let it go. Yes, sir. I don't know. No.
My husband don't think vaccination matter play.
Just say you like the thing more important pass. Make sure say those who get belly, or those who are old, or those who get serious sickness, get the COVID-19 vaccine.
This message now from the Federal Ministry of Health and Social Welfare through the National Primary Healthcare Development Agency, with support from the American people.
Okay. Yeah, sorry, that was clearly from the Africa Cup of Nations campaign that we had implemented. I want to move over to another project that is really critical in the progress of this field, and that is the Bandabareho program in Rwanda. And it's one of the strongest examples of what a sustained gender transformative male engagement program can achieve. It began as a 15-session curriculum for expectant and new fathers, and it was designed to promote equitable caregiving and reduce violence. The initial randomized trials showed remarkable results after 21 months. Those results included a reduction in intimate partner violence, more supportive parenting, and greater reproductive health engagement. But what's really important about this study is the 6-year follow-up. These gains didn't just last, they deepened. Families reported less violence, better communication, improved mental health, and stronger co-parenting. Bandabareho shows us that engaging men early, meaningfully, and as part of a broader vision for equity can have long-term system-shifting effects. I wanted to share this table to give some more context. This is the outline of the Bandabareho curriculum, and that was implemented by RAMREC in Rwanda. It focused on newly married couples, and you can see how this curriculum touches on topics that are relevant to their future. Down the left side of the table, you can see topics that are including becoming a father and childbirth, as well as later sessions that include gender-based violence and alcohol and drug abuse. Sessions are supposed to last between 45 minutes to 2 hours, and they're spaced between 2 to 3 weeks apart. The curriculum builds on earlier projects that emphasize the role of couple communication and conflict resolution. Down the right side of this table are the intended session participants. Like earlier project, Bandabareho uses a combination of male-only and couple participation. And I have another video from the Bandabareho project. It's kind of very general overview, and you'll see mostly couples in these images, in these shots.
Bandabareho is a gender transformative program which engages men in active fatherhood and caregiving in maternal, newborn, and child health in the prevention of violence against women and children. Rigorous evaluation has shown that the approach produces long-term positive impacts in the life of the couples who participated. In collaboration with the Rwanda Ministry of Health and with the support of Global Innovation Fund, the program is now about to be scaled up via the health system through the existing network of the community health workers. The aim is to reach a larger number of couples and to embed our approach within the health system to make it sustainable. The program is implemented by Rwanda Men's Resource Center, RAMREC, with the technical support from the community. Murakaza neza, welcome to Rwanda.
All right. So understanding the potential impact and important important opportunities around male engagement requires spending a little bit of time in a few very recent and important studies. So as articulated earlier in the presentation, gender transformative activities sit at the crux of male engagement programming. This meta-synthesis by Sianis and team examined what young men actually think about male-specific gender transformative health programs. Drawing from 19 qualitative studies, they found that young men consistently reported meaningful benefits, better health knowledge, more equitable gender attitudes, and improved emotional and communication skills. What made the programs work? Safe spaces, relatable peer facilitators, and participatory methods like role play and discussion. But it wasn't all positive. Some of the participants found it hard to reconcile what they learned with existing community norms. And without ongoing reinforcement, change could be short-lived. This study highlights a major gap. These programs rarely address the structural factors that shape masculinity and health behaviors. To be more effective, we need to go further, embedding programs in communities and institutional systems, tailoring them culturally and leveraging digital tools, and expanding the content to include mental health, economic empowerment, and more. Young men are ready. We just need to meet them where they are and stay with them for the long haul. Another recent study, the No Man's Land Report, offers critical insight on the reproductive health policies influencing sexual and reproductive health. It reveals that most global and regional sexual and reproductive health policies either ignore men entirely or include them only as a supportive partner in women's health. This severely limits our ability to design programming that engages men meaningfully as clients, partners, and agents of change. Without clear policy mandates or data on men's sexual and reproductive health needs, like infertility, HIV risk, or sexual dysfunction, our programs are built on incomplete foundations. To advance gender equitable sexual and reproductive health outcomes, finding ways to draft more balanced policies at local, regional, and global levels is essential for improving the outcomes for everyone. In another review, Goddard and colleagues examined 35 systematic and scoping reviews to assess how men and boys are engaging in sexual and reproductive health interventions across low and middle income countries. The good news? Effective approaches already exist, especially those that are gender transformative, multi-level, and grounded in community norms and system change. These programs consistently improve outcomes for men and women with minimal evidence of harm. However, there are some key gaps that remain. There's limited attention on topics including men as contraceptive users or male survivors of violence, and sexual and reproductive health beyond HIV, especially STIs and abortion prevention, are not included. The evidence also shows that programs must be tailored by age, context, and vulnerability, and that inclusivity, reflection spaces, and trained facilitators make a big difference. According to these authors, the call to action is clear. Scale up proven strategies, fill programming gaps, and invest in rigorous evaluation. Without better data and more structural thinking, we risk stalling progress on gender equality and comprehensive sexual and reproductive health for all. The last of the reviews that I included here is really important because it was commissioned by the WHO and is shaping current discussions around male engagement in sexual and reproductive health and rights division at the WHO. Ruane McCanta and colleagues analyzed 68 interventions that engage men and boys in gender transformative sexual and reproductive health programming. Their study found that the most effective approaches use multi-component strategies. This includes a combination of education, persuasion, modeling, and enablement. Programmatic delivery included both men and women in separate and combined activities with trained facilitators and sustained engagement over several months. These are things you've heard in the earlier studies as well. Crucially, community-level mobilization and alignment with behavior change theory made these efforts more impactful. However, the review also revealed critical gaps. Few interventions tackled policy or structural barriers, and under-addressed areas like abortion access and sexual and reproductive health during disease outbreaks remain largely untouched. Many studies showed a high risk of bias because they depended heavily on self-reported outcomes. So for me, the takeaway from this study is that while these programs show real promise, we need more rigorous research, systems-level change, and broader topic coverage to truly transform men's roles in sexual and reproductive health. So right now we're at a critical point in this pivotal moment in the field of male engagement in SRHR. The question is no longer if we should engage men, but how we do so effectively, equitably, and at scale. Moving forward requires continued examination of how men are integrated into sexual and reproductive health policies. And despite growing evidence and strong theoretical support, currently only 16% of global sexual and reproductive health policies address men's needs directly. That's got to change. Yes, men's health is a valid priority in its own right. Yet men's absence from sexual and reproductive health policies fails to establish a runway for positive male engagement in pregnancy, pregnancy prevention, pregnancy support, and later in parenting responsibilities. Moving forward, we need to embed male-focused programming into systems that shape lives, and this includes education, healthcare, and law. And we also need to move beyond the one-size-fits-all programming that's embraced by embracing intersectionality and inclusive approaches that reach men across lines of age, identity, and experience. Additionally, this field has only begun to embrace digital tools that offer scalable solutions, which could include youth-friendly platforms to expand reach. Understanding the sensitivities related to this work, programming must carefully be designed and evaluated. And just as described in the reviews mentioned a moment ago, we need more institutionalization, structural integration, and rigorous learning. This next decade will define whether we truly achieve equitable sexual and reproductive health outcomes for all. Thank you for your attention, and I really appreciate anyone who stuck around this long. Feel free to reach out to me if you want any documentation that was mentioned in this presentation, and I've attached a PDF of the slides that should include several links. Thank you so much.